Welcome back, warriors and supporters, to another great episode of CWF Presents CRPS/RSD is Real. In episode 16, we got the privilege of meeting Dr. Austin Harris. We got to see what a great passion combined with a desire to help people can look like. We also discussed how having a complex and rare illness can lead to tricky situations and significant struggles. Dr. Harris left us with a few questions that we are going to discuss in part 2. Some of those were, what exactly is ketamine? How does it work, and why are we using it for treating CRPS? How is it doing that? So welcome back, Dr. Harris. It's great to have you again.
It's a pleasure to be here. I'm grateful to be able to offer insights and assistance.
And we are so grateful for that. As mentioned in the recap, we left everybody with a few questions. Where did you want to get started first?
Okay, what the heck is ketamine? How does it work? And it is a dissociative anesthetic, but it's far more complicated in what's going on once we have ketamine in our bloodstream. Most medications that we're aware of act on one receptor, right? It's okay, there's a dopamine or an acetylcholine or a nicotinamide receptor, and it's okay, that's where that molecule is going to bind to, and it's going to have that effect. Ketamine acts on 7 different unique receptor types at the same time. That is unheard of. It's the only molecule known to mankind that has that diverse a number of potential actions or effects.
So it can help pain and the mental component.
And it's doing both of those from multiple directions. Right? It's not like just this one receptor is helping pain, this one receptor is helping depression, right? It's affecting all of them at the same time, meaning that in that individual, it's walking and chewing gum. And it is a holistic both experience as well as effect, right? We are getting peripheral nervous system, noticeable physical sensory changes. We are getting a central nervous system in terms of our psychology. We talk about NMDA receptors and GABA receptors and things like that. We are also getting, so that would be like the neuropsych. And then there's the pure psychology, in other words, experiential, right? The ketamine itself has the ability, done properly, to create a very specific psychological state we call ego disillusionment. It is a psychedelic at these lower doses, and the doses we use are much lower, especially starting out, than you would use in like a general anesthesia situation. At these lower doses, it's a psychedelic. Now, people think psychedelic and they're like, oh, you mean like LSD or mushrooms or something like that? Yes and no. It does create a sensory dissociative experience, but different, right? Disillusionment, it is able to turn off temporarily at a neurologic level the very part of ourself that we call the ego. It's the thinking thing. It's the protector, defender, survival mode, all that. It creates the anxiety, either to disincentivize us from doing something or motivate us to do something. But it is that sort of, that is where the impetus or the push is coming from that creates the stress response. Right. And then sometimes that's necessary, but not at baseline.
Right.
The ketamine, when we're doing it right, we're actually achieving this very unique state. And I describe it this way. You can take large amounts of magic mushrooms, LSD, ayahuasca, bufo, 5-MeO-DMT, ibogaine, peyote, mescaline. There are about 300 different entheogenic or psychedelic molecules, both natural and man-made. All of them are in one category, and ketamine's in another. It likes to be in a category by itself. It is. It's fascinating with that way. But In ego disillusionment, imagine it like this. This is the range of your defense mechanisms to bother you, to be like, hey, something's wrong. We need to retreat back into ourselves for safety and protection. You're having a very dissociative experience, but you're not out of range of your own defense mechanisms. Okay, so the ego is still in the room, meaning there may be some therapeutic value to these molecules, but it's just, in my opinion, we're not at a point of understanding that makes it a go-to clinical maneuver. After all, it took 60 years for ketamine, and that's when it was legal. The research has been limited. Maybe someday, but with ketamine, we have thousands of double-blind, placebo-controlled, peer-reviewed studies, trials, and case reports looking at how would we use this molecule different ways, in a way that's going to help the most number of people for different things and be able to modulate the implementation differently for different people.
Right.
It takes a long time.
Yeah.
So back to the metaphor. In psilocybin, you could end up in a situation where you're experiencing a lot of emotional permeability, right? The wall isn't as rigid. And that's a typical psychedelic experience property, right? You feel suppressed emotions, they're processing out, which is, in the long run, a good thing. But in the short run, if our defense mechanisms are still able to go, hey, I'm not sure that's what we do. I need to be back in my illusion of hypervigilant control to feel safe. And that's not possible because the half-life of the molecules range from 6 to 14 hours, depending on which one. So you're pot committed, right? And you can experience a lot of cognitive dissonance, right? Your far over reinforced ego defense structure says, I got to be back in control right now. And the molecule's going, yeah, that's not going to happen for the next 6 hours. So that can be very uncomfortable. And that's what people call a bad trip. That cannot happen with ketamine infusions that are being adjusted to ego disillusionment. Right? Because in ketamine, you're actually outside the range of your defense mechanisms to bother you. So it's not like you're over here watching the movie over there. We are just part of the everything. It's a pure subconscious state because the ego's been turned off. And the subconscious is our everything. It's our infinitely wise processing system, best friend that we ever had. It is our emotional guidance as well as our emotional resolution system. But it's a vulnerable system that you don't have that illusion of control, right? You feel, and that's how it's working. You're feeling it working. In folks that have developed a baseline system of roads, it's, no, I can't trust that. And usually, historically, for good reason. In the present, it's usually disproportionate to current stimuli.
Right.
But it's still, no, I can't allow myself to feel what I feel. I can't trust myself to allow myself to feel affected by things I don't control or have the illusion of control.
Right. It's an extra weakness almost.
And it's unfortunate because that is our everything. And it's the mode that human beings we're in 95% of the time. Even with all that trauma.
Wow.
They would experience the trauma, and then as soon as it was done, they would de-escalate it together as a tribe, as a community. They would come together, drop everything, dance, cry, scream, eat, burn fires, and they would do it the same way every time, all together, out in the open, to click over from ego defense, survive, suppress, and override mode into subconscious release, clearing the slate, instead of just having it build up. And they did this every time. We don't know how to do that anymore. And so
Right.
that subconscious state, even in the best of times, just hasn't been prioritized. And in a ketamine experience, to commune with our best friend, our like near divine sort of guide, it is just absolutely ununderstandable how that occurred, that we have that. We were born with it. And it is our inner healer. Every older culture talked about that. And a lot of their culture was built around that because it's the greatest gift we were born with that we don't trust or use enough. In a ketamine experience, we feel safely released from the walls of our overly isolated experience of self. It's like just being teleported over the side of the wall. And we can't do that for ourselves. And the metaphor that I use is usually we're outside the wall, we're outside the range of the guards on the parapets, and we realize experientially, because that's how we learn, right? We're experiential, not cognitive learners. And we experience, oh, wait, there's no monsters and dragons out here. There's no attacking army anymore. Weird. I had assumed I was operating as if there always has been, but no, now I don't feel it. It just feels like endless rolling hills of green grass and wildflowers and cows and blue sky as far as the eye can see. What has it always been that way in the big picture? Huh.
Is there anything other than ketamine that can trigger that?
Not that. Not that. Yeah. And like I said, you could have some wildly dissociative experiences on other molecules, but you're not able to fully turn off that ego defensive response. You can't expect that to be a sustained, consistent theme throughout an entire experience of, in the case of the protocol that is standard of care for treating CRPS, it's a 4-hour infusion. Okay. What is occurring in that experience is deep and profound. It is a paradigm shift. In other words, new data has now come into our awareness experientially that completely changes our instincts, our response relationships. Back in the real world, we can't really know for sure what it feels like on the other side.
Right.
And it's the shift that we were able to experience is innate. It's automatic. It's, oh, you mean love, self-worth, a sense of oneness and enoughness with our life, our world, our environment, of value, of connection. You mean that doesn't come from trying to get it all figured out, analyzed, judged, ruminated in my own head? You mean it comes from realizing I don't need to?
That has to be an incredible feeling to be able
that's
to
a realization we couldn't come to on our own. Right? We don't have the ability to do that. None of us. And then when you repeat that, and in the proper protocol, you're looking at 5 to 10 consecutive weekdays of infusions. And what you're doing is you're reinforcing that paradigm, right? Simultaneously, you're giving your subconscious, which is our janitorial system, the opportunity to go into all the closets that we've shoved all the toys and clothes and shut the door, pretending that we're fine, and just put it out of mind. All the emotional conflicts, probably going back to when we were young, including our experience of this pain situation, right? It's all down there. It's all shoved down and spilling out. And then our subconscious has unrestricted access to go in and reorganize all that and take what we don't need anymore, safely out the back door, helping us feel lighter, less dysregulated, less pressurized, less volatile, and then really recovering a sense of capability, of the bandwidth, being able to say, hey, maybe I can try to invest this in other places and explore what that might feel like. So that's the psychological side. And then on the pure neurologic side, it does have the ability to, through all these other receptors, target and reset the way we experience physical data, right? So that default mode network, right? It can reset it like a circuit breaker, right? So it is now de-escalating the prioritization of data that's coming through it again, like it was supposed to.
Right.
And that becomes progressive. So like, as someone feels less pain, that is my whole existence, this is the only reality that is, then they feel more bandwidth and capability to go, maybe I'm also my feeling of this sunbeam or the palm tree that I'm resonating with, or a hug from my child or something else. And then, oh, wait, that actually felt good. Let's do more of that. And now, instead of cycling down the drain, you start cycling back up the other direction. And that becomes progressive. It's a shift of momentum. That's what we're trying to accomplish in these interventional programs.
It's that motivation now to find this new person. I've noticed that even for me, when I can't achieve something the way that I used to be able to do it, it's that I just can't do it anymore. And I have to think about it. Can you not do it, or do you have to go a different route to get there? Is it still achievable? And this is what I think is so hard, is that a lot of warriors get stuck in this spot where they don't even want to do that. If this is me and this is what it always will be, it puts you on the up spiral to be able to want to discover that person and make progress and do what you can still do. And I think that's just really hard for people to find, and maybe impossible, like you said. And this is just that nudge that became stumbled upon and is just miraculous. I'm really enjoying this because I've never heard this much about ketamine in this way. And it's just amazing what it can do, and the uniqueness of it as well. Like you said, likes to be unique.
It absolutely does. And it also needs to be used unique, because the ketamine is a great tool, but if we really want to help someone to get sustainable long-term benefit, the goal should be not just to give someone a fish, feed them for a day, right? And so how do you do that? How do you go about retraining not just our nerves, but our whole concept of awareness? That is the name of the game. And if we're not going to address that underlying fundamental, then you're not going to get some sort of long-term sustainable change, right? Once a groove has been dug and ingrained, you have to respect that, right? Our nervous system was designed to not change easily, right? Normally, that's a good thing. You wouldn't want an experience or a neurologic paradigm to shift wildly with every new cross breed. It would be chaos. However, if there is a maladaptive pattern that has become ingrained and instinctive, we have to respect that we will need to overcome that inherent resistance to achieve a sustainable change. So how do we do that? And maybe now would be a good time to explain what our approach is at NeuroRelief, because it's extremely different. It is also unique. As far as I'm aware, it's the only program of its kind in the world. The first thing is how we do the ketamine. 9 times out of 10, most places that would offer a ketamine infusion, it's the same volume model, sort of drive-through operation of corporate medicine, right? Underdosed, set it and forget it, have a nice life.
Right.
Here's a little ketamine. Now we're going to bill you. Good luck to you. Next. And that makes more money, right? But it doesn't get optimal results or anywhere really close to it. If we're really going to help someone, we have got to address that situation and that whole person as an individual. We need to work with them to find the alignment to help, on the one hand, educate, listen, and find that, okay, we're on the same page, right? Now what we're going to do together. It's a collaboration, or as we say, a therapeutic alliance. Now, for me, that's the beautiful thing. I choose to do this because it's a part of my own journey of healing and growth. And in honor of that, the time and the bandwidth that we invest with every single one of our clients here is the underlying ethos. That's the motivation to share in someone's journey of results. Now, what are we going to do with this one person to make sure that we're going to be able to get everything we can for that person? And how are we going to help that person to also start doing things for themselves that are going to empower that journey of healing and improvement? Because it's a collaboration. We have to do both.
Right.
There's also the practical. Okay, you're telling me that I've got to do something else besides what I normally do, which is sit in my bubble in my head and focus on my pain. Okay, but how? Like, what do I do instead? What is the other pattern that you're referring to? Because I don't know what it is, right? We only know what we know that we've experienced. Someone can tell you, hey, Brittany, just be present. And you're just like, go away. I know what English means, but I don't actually understand from a practical, functional, I don't know how to do that to my advantage. So how do I learn that? So the ketamine, in addition to pain relief, resetting of central sensitization, subconscious emotional processing, resolution, and cleansing, also at a receptor level will turn neuroplasticity back on again. Right. How are we as the individual, as the client, going to give them the directions that we don't know how to give?
Exactly. Each person and each person's journey.
Over the many years and a lot of my own learning and trying things both for myself and for others, the 3 things that we're doing in order to help the client do for themselves, it's simply where we focus, we feel. It's a mindful underpinning. In other words, we're using mindful cognitive behavioral exercise, a very specific, trained, guided, and supported mindfulness meditation program, certified integration and recovery coaching, hour-long sessions over Zoom, one-on-one with a personal coach with background in certain specific techniques like somatosensory experiencing modalities. All of this serves as a, here, try this. And then the clients all they have to do is literally like paint by numbers. There's no grand understanding that needs to take place. There's no analysis, figuring, judgment, or struggle in comprehension. It's simply like literally put one foot in front of the other. It's just, all you got to do is follow directions. And just by engaging our awareness in these very specific patterns, it is telling our returning workers very specific directions. Build here, not here or here, but right there. they will follow directions because finally they're back to actually receive them and do something about it. In addition to all the other aspects of the ketamine experience that are beneficial, that implementation, the support and guidance in order to help that person develop the insight and the motivation and the support in order to just do those things, they're very simple and very effective. Every single one of our clients at NeuroRelief has my personal cell phone number, and I'm reachable 7 days a week in real time as a guide and a support system through this powerful and potentially transformational journey of healing and growth. And I have found that's what it takes to really tailor and dial in and customize and support unique individuals with what they need to be successful. And when you're combining all of this together, we have an 80% success rate. Medical success is defined as a 50% or greater improvement in baseline symptom scoring. Nobody else is keeping track because they don't want you to know that you're not getting a full success. But with us, we utilize independent, HIPAA-secured outcome metrics with NIH-approved research assessments. It's not what you're paying 1 to 10, right? That's not real data. It's an objective collection process coming from the patients, but in a tangential, abstract way that is very valid in terms of this is what you would do if you were studying chronic pain and you were trying a drug or a device. You would need to do these assessments. So we're doing that before, every couple days, during, and after, and seeing what's working. What are we doing? What is the client doing? And it's only after that's done that we're looking at, okay, where did we end up? And so what that means is 80% of our clients are experiencing at least a 50% improvement from baseline symptom scoring. 50% improvement is life-altering.
Right.
And that is just the minimum. If someone gets a 49% improvement in their pain and disability assessment, I don't count that as a success, even though that probably was life-altering for them. I like to stick to the letter of the law so that we're validating our processes.
Now that you've explained all of that, how does that look if I were to come into your office as a CRPS patient? How does that all play out?
Perfect question. So first, let's talk about how the ketamine works. A CRPS patient, we actually offer different duration infusions for pain syndromes, certain neuropathies, rheumatoid arthritis, ulcerative colitis, Crohn's disease. There's a whole host of different conditions that we're able to treat with this, and we don't use the same protocol for everyone. It should be specific to the individual. For pain situations, we have two different protocols. We have what's called the 2-hour protocol and the 4-hour or Schwartzman protocol. The 2-hour protocol is non-central sensitization types of pain. But for central sensitization, there is an evidence-based protocol that was first popularized by Dr. Schwartzman out of Yale and should be standard of care for these situations. And that is 5 to 10 consecutive weekdays of 4-hour ketamine infusions each. So Monday through Friday, then they take a break, they integrate for the weekend, and potentially Monday through Friday of the following week. Each one of these, the dose is going to be progressively escalated because tolerance, our body's ability to break down ketamine, actually occurs very quickly. So we have to always stay ahead of that to achieve optimal therapeutic value. And there's a very good correlation between dose and benefit. Now, almost nowhere are they either comfortable or able to provide the doses that are really necessary to achieve optimal results. But that's what we do at NeuroRelief. So that's from the clinical perspective on timing of the infusions. Now, it's also important to understand how we give the infusions. It's done through an IV with a special anesthesia pump or machine that is delivering that ketamine infusion. Now, even in places, let's just say for the sake of argument, that they were giving a 4-hour infusion, right? How is that being done? They decide in advance, usually underdosed. Okay, we're going to give 0.5 milligrams per kilogram per hour. Dial it into the pump, hit start, and walk away for 4 hours. Come back. Good job. Next.
Right.
Okay, and I'm serious. That's 98% of what is out there. But that's not the right way to do it. The right way to do it is what we call real-time titration or adjustment. That means that moment by moment during the actual infusion, we are adjusting the dose delivery rate, i.e., what the patient is experiencing, the depth of experience, to dial it in real time to their specific neurology, psychology, personality, and defense mechanisms, physiology, metabolic tolerance levels. All of these factors vary widely in the general population. So guessing and then just letting it run is not optimizing the opportunity, right? We're adjusting moment by moment to certain clinical, therapeutic, and experiential endpoints so that we're guaranteeing that client is getting everything they need and should get, even from the experiential side, which, as we talked about psychologically, is very important.
So there's
and we're analyzing constantly, myself directly and my team, body language, facial expression, speech phonation, the patterns of talk, the way people's vital signs shift slightly as we do different things to test the waters. Eye movement that ketamine seems to affect. While they're in a very deep, transcendent experience, they're not unconscious. They're not under anesthesia. They're still able to respond to basic questions like, "You're doing great, Brittany. Are you in a good place?" "Yes." "Would you like to go a little deeper?" "Yes." Boop, boop, boop. And we're adjusting in real time with that client, that moment, that day, to optimize the effect of what we're doing. Obviously, that takes a lot of attention to detail, which is why doing it that way is not what everybody else does, because it's very difficult to scale or volumize a practice or business model that way. But it's the right way to do it. The other incredible thing about ketamine is, in addition to be able to achieve, done correctly, that state of ego disillusionment that we're aiming for, that's a therapeutic goal, we're also able to understand that the half-life of the ketamine molecule given IV at the receptor level is not hours like psilocybin. It's seconds. Meaning that the adjustments that we're making are experienced by the client instantly. So there's this incredible precision where you really can dial in and optimize and adapt to that client moment by moment to guarantee things.
Right.
So it really is a beautiful process. And for me, that's what makes it wonderful, right? Because it's artful. It's each client, each moment is a unique opportunity to analyze and adjust and flow with that person's experience.
I was curious of if you get a lot of people that have tried this.
All the time. And I'll always ask for their records from wherever they came from. And it's not that complicated when you know what you're looking at to go, okay, I see what was done before, and I know what we are going to be able to do significantly better. And they do experience significantly improved results.
That's nice to hear, because I feel it hurts to see people that get treatments and they think that they're unsuccessful when it's not necessarily that the treatment's unsuccessful. It's just how it is administered.
It's one of the things that I'm very passionate about, because we want to see this tool become far more normalized because it really is the only evidence-based therapeutic option for people with CRPS. And that is not limited to one little area on the body. If it's just their left foot, the other thing that could be done would be a spinal cord stimulator. But that's an invasive thing. Even the spinal cord stimulator would only be effective if it was isolated to one small area. But for folks which is not uncommon, they have CRPS symptoms in multiple areas of the body, especially above the lower extremities. There's no place to put that stimulator that is going to cover those areas. You were going to ask, what is the timeline? How does this play out? Someone calls us, okay? And they have a detailed phone consultation with our intake team and often myself. In these situations, I will get on the phone personally and probably do an hour-long phone call to understand, as we've been discussing, the whole person best I can in a sitting. Whether they choose to come work with us or not, it's always a blessing to love what you do and to be able to share that with someone else. They will then be sent out a detailed intake process online to further elucidate all these different factors. They will then meet with their integration and somatosensory experiencing coach for preparation and a setting of intentions. Then they will come into the clinic for the first time. I will meet with them for about an hour and a half or 2 hours, one-on-one. We're going to go again into depth on what are the patterns that are present, listening to them tell their story so I can absorb that and try to learn how can I be the best guide and support system for that individual. Right. And that approach is something that's always adapting moment by moment through the program. It's not something we just decide up front and then play out some sort of algorithm.
It's not a one size fits every patient.
We actually, I think it's on our website, we say it's one size fits one.
Yeah.
And after that intake, we're also in that intake going to be introducing, training, and onboarding some of these other tools that the client's going to be using in their own reprogramming process, like the mindful CBT exercise, the mindful meditation program, etc. That person is empowered and also has a really solid foundation. So as they go through this powerful process, they have that to relate to, right? That we're aligning myself, their coach, the patient under, okay, what are we doing here? How does this work? And then how are we going to work together to modulate and adapt this process to you, with you, as you're progressing through it?
Right.
After that intake consult, they're going to go to another area of the clinic and they're going to receive their first infusion. And everything about that will be customized. The next morning, they're going to have their second integration with their coach before they come into the clinic. So we bookend that first experience with 2 integration sessions. We're nurturing the beginning of what is a powerful process and a lot of emotional processing. Each morning, either every day or every other day, they're going to be getting an integration session with their coach, then coming in for their 4-hour infusion, recovery, and going home to resonate with the processing of their experience, embracing that, and then giving their bandwidth to these strategies, these tools, these exercises or meditation that is teaching us how to focus and feel differently. And that is now going to be coded in as actual infrastructure and instinct.
You're implementing
from the beginning.
Yep.
And continuously throughout the process. And that will continue whether we're doing this as a 1-week or 2-week program. It really depends on the client's ability. More is better, but maybe not absolutely necessary sometimes. And so that's always a discussion that's going to be had with the client before, during, and at all interviews as to where they're at and what they are comfortable with experientially, symptom-wise, financially, etc. Okay?
Okay.
And that will continue. And then even after their last infusion on either the first or second Friday, they will then have some follow-up integration sessions to bring it together and try to solidify not just, okay, I got these infusions, but how am I as a client feeling that I've now built my own new fishing rod and I've been practicing using it. I feel what that feels like. I trust that structure. And I feel comfortable implementing it moving forwards. And with that, it's called a stabilization protocol, that first 1 or 2 weeks. That's all the heavy lifting. It's still likely beneficial for a client at varying intervals to possibly come and have a booster infusion or a maintenance visit. Sometimes we're just experiencing significant benefit. It's all about embracing the fact that we're all a work in progress. And that as we continue that journey of implementation and real life, it's very helpful to have support, not just psychologically, but also neurologically, periodically. What is the path that we're building here? That's just a form of self-care that a client chooses to or not to utilize, whatever they feel is appropriate for them. I don't tell people what to do because it varies significantly, right? I've got people that maybe come back once a year. The goal is always, however, to eventually move towards them feeling totally self-sufficient and independent, right? The goal isn't to try to incentivize a revolving door of need, but we absolutely must support that person. And that will be different for everyone as they're continuing that healing journey.
And can anybody come from anywhere to?
Anywhere. We have people that come from the local LA area. We have people that come from out of state. We have people that come internationally. And for those that are traveling from distance, what we'll do is we'll work with that client to try to help them arrange a location to reside that is close to us, that they're able to get transport to and from the clinic. But what we recommend to people is they don't come alone, right? It is an intense process, and we don't want people feeling like they're having to figure everything out for themselves. So having someone that they know and trust to allow them the bandwidth, the liberty, and the wherewithal to invest only in their program, right? And not trying to figure out Los Angeles. That's something we need each client to figure out and have that person with them here. Obviously, that's a lot easier if they're local in the Los Angeles or greater area. But even if they're, not, and if they're coming from a distance, that's still very important. It's all about we help people organize that and try to make things possible for each person, including financially, right? This is not an inexpensive process. It's a truly holistic recovery process, utilizing cutting-edge technology and science combined with that integrative, okay, now what? And to be able to build that in a relatively short period of time. I'm happy, like I said, just to be a resource or to be able to provide information to assist people, whether they're working with us or on a journey somewhere else. Information is power and comfort. If we're just talking about the ketamine, because that's mostly what you're going to see out there, right? It cannot be less than a 2-hour infusion, but it should be 4. If it is CRPS and it is a central sensitization situation, it should be 4-hour infusions.
Okay.
And it needs to be at least 5 consecutively, Monday through Friday. Okay. And they should be aggressively trying to up titrate the dose over the course of that week. So the amount total that you're getting on Friday should be probably 4 times higher than that which you got on Monday.
Okay.
And if possible, finding a place that actually does adjust the infusion midstream. Not they give you a bunch of ketamine and then you come in the next day or whenever they have you coming in and they go, so how was your last one? And they might tweak a little bit here or there, but not significantly. These are really important opportunities and we want to get everything we can out of it. If you are able to ask those questions, then possibly if there is someone there that at least can do that, then maybe you'll be asking them to do that for you, even if that's not what they normally do for most people.
And it's comforting to know for people to know what to ask, because I think sometimes we don't know what really is the most important part of the details of the situation.
Mm-hmm.
And
if the other thing I would say is this should still be an integrated process, right? If we just go and we go, okay, as long as I get some ketamine in my body, then all the stars will align and that'll be all I need forever to fully recover from my CRPS, whatever caused it and whatever patterns are progressing it. I don't think that's a realistic expectation. I think that we need to address either with your own therapist or maybe an integration coach that you hire separately. And I do know some companies that could be able to provide those services for people outside of the clinic that they're getting the ketamine from.
That would make sense, though, if you couldn't do that, to optimize as best you can to find it in each place. You build your own team of people, and I would like to eventually go into that. I just learned that you could take it other than an infusion not that long ago, and I didn't know that was an option.
It's not the same. And for really clear scientific reasons. It's not to say there might not be some value for some purposes. And I think that can be a value for some people in the right experienced hands and to overcome that inherent resistance that we know is built in, to be able to actually convince our neuropsyche that, oh, we're serious. We really want you to remodel and repattern after these new signals that we're showing. And so when it comes to pain, it should be a minimum of a 2-hour infusion. And if it's central sensitization, CRPS, RSD, centralized severe migraine syndrome, things like this, it really should be a 4-hour infusion protocol.
Okay. It's good to know then. Now we have a baseline for anybody that can't. And I believe a lot of this is on your website.
Everything that I've said, more or less, is on our website. It's probably the most in-depth from a scientific as well as a holistic understanding of how this tool should be used in an integrative way to really change things for whatever it is we're trying to change. And on each page of the conditions we treat, there's multiple sections. It goes into the neurology and the receptors and understanding the process and the program and the components. And at the bottom of each page, there's a section called Customized Protocols for Individual Clients. And it goes through for, let's say, depression, anxiety, PTSD. We have a 1 and a 2-hour protocol. It explains why and what are the things to look for as a client to determine maybe whether I could consider one or the other. And then for pain, there's the same section, and it talks about the 2 and the 4-hour protocol and the differences between them and why we believe certain people need to strongly consider a 4 versus a 2. Having some treatment's better than no treatment. But I think that it's our ethical responsibility to educate and help people make informed decisions so that they're empowered in their own turn.
I can't thank you enough for taking the time out of your day to sit with me and go so in depth with everything. So I have a full understanding and we can share it with others and hopefully get them to be able to have access to treatment that will actually help them long term.
It has been an absolute pleasure, Brittany. Thank you for this opportunity and thank you for the work that you're doing. There's a lot of people out there in need, and I think you're doing something similar to myself where experiencing the sublimating reward from helping other people in areas that we're personally familiar with. I give you great credit for having the courage to do that and the good work that you and the others at CRPS Warriors Foundation are doing for people around the world.
I can't thank you enough. It's nice to know that people out there like you have a patient's back and will dedicate their life to finding something. So I can't thank you enough as well.
Thank you.
And I look forward to our next chat.
Absolutely. Myself as well. All the best.
If you are interested in connecting with Dr. Harris, all of his contact information is in the description of this episode, including his website, NeuroReliefKetamine.com. It's a great site, very informative. You can also read patient testimonials and much more. If you would like to support the podcast, please text CWF Podcast to 53555. We are also in the middle of Awareness Month. We are striving to be able to help as many warriors as we can. But we need your help to do that. If you would like to help, please see the link in the description of this episode of our CRPS Awareness Month campaign. Small gifts, complex solutions. We also have one more group coming up this month. That will be on the 30th of November. Registration will remain open until the day before, and December dates will be announced shortly. So make sure you follow us on social media or subscribe to our newsletter to stay up to date for our events, fundraisers, and support group dates. Our next episode is a bonus episode that will be released on the 25th of this month in honor of Awareness Month. Stay tuned to our social media to find out more. As always, it has been an amazing pleasure. I will see you all back on the 25th.